Hey, I'm Michelle. I'm going to talk you through variations of labor. Prodromal labor is when you're just contracting, but no cervical change is happening. It's very frustrating for the mom because it can be really uncomfortable. The definition of true labor is contractions plus cervical change. So without that progressive cervical change, you kind of fall into that category of, unfortunately, just prodromal labor. Oftentimes what we'll offer for moms in that situation is called therapeutic rest, which is Nubain and Phenergan. Nubain's a pain medication and Phenergan's an anti-nausea medication that also has the effect of letting you get some good sleep. Our moms who have this prodromal labor or just very long, early labor stage benefit a lot from therapeutic rest because it just lets their body relax. Most moms who get therapeutic rested will go home, sleep for 4 to 5 hours, and either wake up and their contractions have petered out, or they wake up in a better, more effective contraction pattern and go on to have a more efficient, effective labor. Back labor is oftentimes tied to fetal position. Sometimes it's not. Sometimes it's just how your body's response to labor is. But oftentimes it's just how your baby's coming down, whether they're sunny side up, which is where they're facing your front versus facing your back, coming down sideways, or however they're positioned, wherever part of their head is pushing on your back is what's irritating that back part. Here at the Birth Center, freedom of movement is huge for it because we can get moms into different positions to aid with fetal rotation, which is the biggest thing that's going to help back labor. Here we also have sterile water injections, which are extremely helpful. I gave a mom them just last week and her back pain went completely away. It was amazing for her. And all that is sterile water that's injected underneath the surface of the skin, just like a TB test if someone was to get. And it just works by essentially tricking the mind to focus on that pain stimuli versus the pain of the contractions. So that's a really good tool to have here to help people with back labor, especially for moms who are coping really well with contractions, but the back pain is just what's debilitating them. So between the position changes, the sterile water injections, the tub is helpful just with water submersion, just to take that pressure off. And oftentimes we have nitrous here as well. So we have a lot of tools kind of in our toolbox to help with not only normal labor, but back labor as well. We have a lot of good relief from the TENS unit. So that's just 2 electric pads that apply to the back, and you can adjust the stimulation level essentially, and it's just an electric current that kind of passes through and helps to distract from the pain as well. Prolonged labor is a little different for everybody. Some people have had fast first labors, the second baby's taken their time, or their third. Oftentimes prolonged labor is seen in first-time mamas, just because their body's never done it before. The best thing we do for prolonged labor is just help mom with mental coping, because that's the hardest part of it, is just kind of keeping that stamina going, staying energized. Part of that is the ability to eat and drink freely. So keeping mom having frequent meals and good hydrating drinks like coconut water and Gatorade, and just keeping her energy and spirits high is a big part of labor when labor is taking a longer course. And that therapeutic rest comes into play as well. If somebody's having a non-progressive, really long labor, we can give them therapeutic rest to let them sleep and just let their body work. Oftentimes we'll tuck moms in with a peanut ball, which is a positioning aid, so that they can rest but still have good open pelvis shape, and kind of we can change their position in the bed but still allow for that good fetal rotation and descent to happen. Sometimes with long drawn out labors, what we usually encourage in anybody's labor when labor starts is when the contractions are mild and still tolerable to try to rest. And the more you can just lay down and kind of doze and then wake up and breathe through contraction, lay down and doze, wake up and breathe through. In the early stages, the more you're setting yourself up for success if it does take a long course. That way when labor gets to pick up and be more intense, you're not already behind and running on an empty tank. If labor is very long and drawn out and the mom is just exhausted, that's when it comes beneficial that we also have hospital privileges. Some moms elect to transfer for an epidural at that point. Oftentimes, just with fatigue, the uterus is also tired from working for so long and so hard, that sometimes the best course of action is to transfer and get an epidural, because it just lets the mom tuck in and rest and just be relieved and just let her body continue to work and the baby continue to come down without her exhaustion factor coming into play. An epidural can sometimes be a saving grace for labor. It can be the difference between having a successful vaginal delivery or ending up having to have a C-section after just a really long, exhausting labor. Precipitous labor is always an adventure for both parties. Some babies come fast and furious. We are ready for either way labor goes here. What's nice about the birth center is you're already pre-registered. We know who you are, we know you're coming, so it's not as big of a step of a check-in process as it is at a hospital facility. Oftentimes the midwife knows you're coming in and delivery is imminent, so we'll have the room ready. You can just come in, hop in the tub. Some moms don't make it. It's not super common to not make it and have your baby in the car or at home. If that was the case, every single midwife has an emergency bag in their car with neonatal equipment and medications for mom and everything to keep mom and baby stable. We often will have the mom still call us and keep us on the phone if they are delivering at home. That way we can talk them through it as we're driving to their house. Once the baby's here, we often will come to the birth center just for recovery, just to make sure everyone's stable, still do your normal postpartum recovery here. In the event of delivering in the lobby or something like that, we have had that happen one time, but she just hopped in a wheelchair, had the baby in the lobby, wheeled up, recovered up here, and everything went smoothly. But for the most part, you're in close contact with whoever the on-call midwife is, and we know what's going on, we know what to expect and how to coach you, and if it seems like you will make it here, we'll encourage that. If it seems imminent, then we'll come to you if needed.